Tuesday at 1:30 p.m. on ZIZ Radio, The Health Link, because a healthier nation starts with you.
You know that health is wealth and ital is vital. They're not just some rhyming words. It's something that's just got to be heard. Who is responsible for your health? Look in the mirror, it's your very own self. You can't rely on nobody else. Health is wealth, ital is vital. Try and take care of yourself. Health is wealth, ital is vital. You can't rely on nobody else. Health is wealth.
And good afternoon to everyone. Welcome to the Health Link, where everything is connected and your health is the link. As usual in studio, you have myself, Ms. Chevaughn Richards. I'm the PRO for the Ministry of Health, and I'm your host today. And with me is one of my favorite guests, Dr. Patrick Martin. And we are here to talk today about our shared responsibility. Our health, our shared responsibility, tackling NCDs and obesity together. Good afternoon, Dr. Martin.
Good afternoon, Mrs. Richards, PRO. Thank you for the invitation.
Always. Such a wonderful engagement every time. So today's topic is very interesting. We're talking about whose responsibility it is to secure or ensure that the nation is healthy. Is it the government? Is it the churches? Is it the citizens? Who exactly carries this responsibility?
Well, we live in a democracy, and it starts with we, the people. Yes, government has a role to play in providing the enabling environment to access the services that we ourselves cannot provide individually from our individual wallets. But in the final analysis, it is the individual's responsibility, especially the adult responsibility to take charge of their health, because as the theme says, health is wealth.
Lovely. So let's break it down a bit, though. So as far as responsibilities are concerned, I think a lot of people may not be aware, or they may not be looking at themselves as far as health. Like you said, you hear a lot of people saying, well, it's how they have the system set, right? And then when you look at things like public health, you look at COVID, which happened in the not too far gone history. And some persons are feeling that they don't really see how they have a choice. And I think it really shows up a lot when they end up in front of their doctor. And the concept is, tell me what to do. And they don't really see how, first of all, how their actions might have contributed to where they are, and how their actions can actually help alleviate or take them out of the present situation. And that it should be more of a collaboration between doctor and patient, state and citizens.
The evangelists of it's the system are very popular and frequent. This is about manipulation of vulnerable people or persons who may be in a space temporarily that they need that they need to recover from. And so manipulators take advantage of people and seek to provide them solutions that they, the manipulator, will profit from. And so the recommendation is back to the beginning. Adopt a positive attitude, mindset that the glass is half full, not half empty. Yes, there are conditions and factors up there that may appear to be insurmountable, but our ancestors went through worse.
Truly. And so, okay, like the issues like NCDs, where these are like non-communicable diseases, high blood pressure, diabetes being some of the most common ones. The state does put things in place where, for instance, diabetics are able to access medicine freely and readily through pharmacies, to clinics, and so forth. We do have support for elderly, for children, and for those who can't afford it, luckily, in our nation. And people are able to look towards the state or the Ministry of Health, more or less, for guidance in this way. And then you have the private doctors, and so you speak about even the manipulators, and this is where, again, policy would come in to regulate what doctors are able to do and to monitor and so forth. And then that ends, though, once the person leaves the institutions or the doctor's office, and now they have to go out into their regular lives and implement a lot of the advice, the instructions. And then now you have, in this modern times, like never before, the giant of marketing. So you have a diabetic, the state is saying one thing, and then you go out and then you have all these psychological ads and so forth. Like, for instance, we tell persons at the ministry, no, we're saying not even one glass of alcohol. Science is showing that it's no good for you. And our culture, on the other hand, it's telling our citizens during carnival and so forth, you know, all the songs are about rum. It's so ingrained in our culture to drink and to have it be a part of festivities. So then even when you go to certain functions, the main sponsors are often alcoholic beverages as well. So you can understand difficulty that some citizens might land themselves in.
Yes, so we face an infodemic.
That.
A term coined by the World Health Organization. It's a tsunami of information out there from credible and non-credible sources. Mm-hmm. Who are the credible sources? The credible sources are the persons who looked after your grandmother, your grandfather, your mother, your father. You know who they are, the general practitioners, the nurses, and others who, over the years, at least since the 1952 universal adult suffrage, when the public health system was put in place by representatives of the people. So we have come a long way since then. The evidence is in the life expectancy. Life expectancy back then was 40 to 50. Life expectancy now is 74. Back then in the 1950s, we were losing maybe 150 children per year before their first birthday. And now that number is around 5, 6. So here in the St. Kitts and Nevis and the Caribbean, we have credible sources of medical information. But alas, we are bombarded, and so there is a war for hearts, minds, and wallets. I studied in the United States. My medical study was in the United States, so I know about that. I was taught about that. And yes, there's a constant battle between what is scientific and what people believe in their hearts to be true. And by the way, the fact that we have people who are influencers, who call themselves influencers, that fact means that they are making money from the influencing. And I understand it could be in the thousands or tens of thousands of dollars in the influencing. So you have to ask yourself the question, what do successful people around me do?
Mm-hmm. One of the things I saw recently, there's this Caribbean coalition, and they basically, I don't remember the name. I'm going to look it up.
Healthy Caribbean Coalition.
Yeah. So they are tackling this, what they call irresponsible advertisement and stuff, especially where children are concerned. Because with the growth of the increase in childhood obesity, even childhood diabetes and so forth, they are saying that, at these sports matches, you should not have certain brands that are alcoholic and, other things, high sugary foods especially. And I think people are open to, you shouldn't have no one being advertised in children's events. But then what they're saying is a lot of this stuff that are promoting kids' events are also pushing a very high sugar, unhealthy diet. And if you look around, you'll see even some of the box juices, some of the posters, and you have kids on them. You'll see them sponsor a meat or whatever, and then people say, well, how do we balance that? So they are pushing for more control where that is concerned. And I think I think it's something that perhaps just went over a lot of people's heads. Like, you just wasn't looking at it that way, because we assume kids eat sweets. Like the other day I was in the shop and this lady was looking at snacks, and I said to her, well, somebody was troubling with her, and they said, all them snacks here. And she said, no, I don't eat those things. Those for the kids. And a lot of us have that attitude of saying, me not eat that junk, let the kids have it. And there's this assumption that junk is for kids. But now when we are facing childhood obesity, diabetes, and children experiencing these sort of diseases, we now have to stop and rethink that attitude. And some are feeling the government should put have more stricter rules and come in that way.
The minute after the government puts something in place, somebody is trying to violate it.
Yes.
And we have a coastline of 70 miles, and somebody will smuggle it,
True.
or try to smuggle it. Here's the point. The Healthy Caribbean Coalition is a wonderful organization, and if you can log on to their website or Facebook page, would be good. But I'm happy that the concentration is on the marketing, because, quite frankly, the marketing is predatory.
Yes.
That's a term that is used, predatory marketing. People are out there to get your wallet, period. And what we have to do as health policy, health information people, is to share with people examples as to how people are trying to separate you from your wallet. All right. And so the use of influencers, packaging things in a certain way, that using colors that would attract you.
Yes.
Those are the reds and the blues and stuff. And giving you the first installment free. Take the first one free.
Of course.
And that may then create an addict for life, or a loyal person for life. And then you're not cool. In order to be cool, you have to eat this, drink that, or wear that. All right. So we have to be mindful of the fact that the predatory marketers use a lot of science, a lot of psychology.
A lot of psychology.
And even professionals are vulnerable to that too. So you tell people, it's not, we're not blaming you. This is high science.
Yes, I like that.
This is high science, right? What we're saying to you is that learn how to be a discerning consumer.
Yes.
People used to tell me, I don't hear it so much now, well, if it's bad for me, then why did they make it? Well, they made it to make money.
Or if it was that bad, it wouldn't be on the shelf.
And so it's on the shelf. It's on the shelf to make money.
Yes.
Is it on the shelf to keep you healthy? Well, the healthiest stuff is in God's supermarket, which is nature.
Mm-hmm.
All right. If it comes into the country in a box, can, plastic, it's secondary.
Mm-hmm.
It's been in a warehouse maybe for months.
God knows how long. You know,
And dented tins and giveaways are dented tins and rusty tins.
Mm-hmm.
Giveaways are expiration dates that were yesterday. You know, so and then the giveaways are labeling something as organic when the rules for organicity are not 100% organic, but you can get away with a 90% organic. So all those little tricks
and even
to separate you from your wallet.
Even the I know, like, growing up, when we thought of fruits, I was telling somebody that I didn't really like fruits growing up, but then I didn't know what fruits were when I look back at it. I thought, because when you talk about local banana, watermelon, papaya, we never used to really, as a child, I never got the impression that they were fruits. When they said fruits, they were talking about the apple and the foreign fruits. Whenever they would say, come eat, they would always say, come eat a banana, come eat a piece of papaya. But for those, it was almost like the word fruit. They were elevated to the word fruit. And then as I got older and start really looking inward, I realized, because I didn't like the store-bought fruits, like most apples taste rich to me. I'm sorry. Most of them I don't enjoy. The pears, you have to leave them on your table for like days for them to ripe. And then in getting older, I realized it's not I don't like foods. I just don't like those. So it's like a lot of the foods that grow locally, they're a lot more nutritious as well. And then recently when you find out like oranges are being sprayed to look orange and the amount of pesticides on the food. I just had a recent run-in with pesticides. And then as a female now, you have a lot of women out there and the obesity problem. And I was talking to another friend and we were like, a lot of women are not only overweight, they're inflamed because a lot of the glyphosates, a lot of the pesticides that come into the food, some of them are endocrine disruptors, some of them act as estrogen in the bodies, some of them create a lot of inflammation. So then you have women, and women are particularly, to me, susceptible to these things. We're more sensitive. And then you have women who can't lose weight and they're saying, I'm not eating, I'm trying everything, and I'm just gaining. Or it's a lot more complex. Once ago it was like, if you're fat, it's because you eat too much. No, it's more of you're eating too much of a particular thing that is a non-food, or a chemical is causing a hormonal imbalance, And so when we think about NCDs and being overweight, the issue is a lot more complex now.
This is the reason why organizations like the Healthy Caribbean Coalition, these organizations are encouraging clinicians like myself, doctors, nurses especially, to become more au fait with what's in quote-unquote food and how it's affecting people. So you could bring people, when somebody comes to you, they're coming for advice, and you could bring them into a zone, but they have to be willing.
They have to, yes.
The person has to be willing to listen, ask questions, and the clinician has to make it possible for the person to ask questions.
Yes.
So I was going to say gone are the days. Well, clinicians like myself who put up a barrier that, I'm a doctor, therefore I know, we are a problem. It's a conversation you're having with people, and you're directing people to credible websites that they can do research on their own. Stick a pin. That's when you could find out persons who can't read.
You mean comprehension?
Yeah, right. So that's another conversation now. Okay,
yes.
so let me help you to get some other kinds of assistance, right? And can't lose weight. No, I wouldn't accept that. You can lose it. But it is for the person who is your weight loss coach to find the root cause or causes of your gaining weight and attacking those causes with appropriate responses. You raise a point about the fruits, what were considered fruits. Bob Marley pointed us in the right direction when he said, emancipate yourself from mental slavery. So slavery was physical and mental.
Of course.
Well, is physical and mental. And the mental aspect of it is deep.
Very.
And so it said to you that what you have is inferior. It's not a fruit.
No.
The fruit is what. So if you pick a mango from St. Kitts and Nevis, send it overseas, and come back. That's a fruit.
Yes.
Right? So that was done with the sugar. You took the raw sugar, sent it to England, and it came back as white sugar, and people said, "Great."
You know what?
So
I understand.
that programming.
Affects.
And so the clinician, the person who's reaching the persons like you and DJs, who people listen to, we really need that teamwork understanding that this is about showing people how it's not their fault, it's how the manipulation works.
Yeah.
In favor of other persons.
And it's gonna be. I often make videos, and I've actually put on my platform that I'm trying to lose up to 20 pounds, because when I did my BMI, I'm actually overweight, 5'7" and 170, almost 180 pounds.
Well, stick a pin. I say to women, don't be so rigid. It's a range. No. It's what your skeleton can carry.
Yeah, but I know where the fat. As I told the people,
a little bit of fat. We need fat.
No, where it is, it's not healthy for me.
We need fat because women women go through a thing called menopause, and the fatty tissue can store some hormones. So fat is not all bad. It's how it's portrayed. All right. Too much of anything is bad for you.
Yes, and particularly where the fat is, we've been told as well. And so that's my concern.
And on autopsy, you can see where the fat is around people's liver and heart and stuff like that. So there's fat you can see and fat you can't see.
Yes.
All right. But in the final analysis, how did it get there? It got there by consuming food and beverages.
Well, mine was pregnancy too. Women go through a thing called pregnancy.
Well, that was part two, is that there's some hormone imbalances that take place during episodes like a pregnancy. And as you mentioned, there are cosmetics and chemical additives in food that can upset the balance. But principally, the fat gets in through your mouth.
Yeah, that too.
So you are what you eat.
You quite literally become what you eat.
And unfortunately, too many people in the world are digging their graves with their teeth.
And it was important for me to even, because women, we're sensitive and we don't want to look a certain way. So for me to say, okay, I need to lose some. We're very conscious.
What is the way women supposed to? Is there a one way supposed to look?
Women have a lot of pressure as far as how they're supposed to look.
Who's benefiting from that?
Different beauty standards. Of course, there's the argument that companies and so forth. And so sometimes as somebody who makes content and so forth, it's hard to share some of your personal experiences, but when you do, you help to educate people as well, because I think that our idea of what too fat is, or what fat is a bit unrealistic. Like, they feel you have to be like close to 300 pounds, some people, before you're considered.
Well, what we're faced with is that people are saying you are supposed to look a certain way.
Yes.
One size fits all. And if to get to that way, I have this product is right for you.
Oh.
And it's held up to the camera. And it's usually a product that is cooked up in somebody's bathroom or garage.
But this is why, too, as you said, like, educating yourself, finding out, doing research, and finding out why you're having the issue. So if you're trying to lose weight and you realize you're not being successful, you have to do some research, because, as I said, it's not as simple as it was before. It's a lot more complicated, even down to the creams we put on our skin, having these fragrances, phthalates. A lady said to me, oh my God, she has hormonal imbalance and now her doctor is telling her she can't use perfume. And she's like, not perfume, but yes, the phthalates and all these things in the cosmetics, the makeup and so forth. And it's not to say that you can't use these things, but you have to find the brands. You have to educate yourself on the organizations that you can turn to. You have to educate yourself on what these chemicals are. So even though you have countries like the UK and so forth that ban certain things, people are constantly on workarounds. Like, they might ban this and they find a different, like, now there's this big argument about BPA. BPA free. But now what they're saying is, yes, when they took the BPA out, but the chemical they replace it with is just as bad. So but nobody looked into that. So people work around is to make money, so they're going to find a workaround.
So you hit the nail on the head again.
Mm-hmm.
So when foods are taken from their natural state and put in a can, box, plastic, etc., there is some degree of manipulation.
Yes, definitely.
And it can be difficult to get across to a person who is in this instant gratification mode, who says to you, I don't have time to cook, or I don't have time to prepare meals, or I don't have time to eat. Then you'll know you have a person who requires a more careful and approach, probably involving colleagues in counseling.
But it's interesting you said that too, because I had a conversation again this morning. We were talking about how having a 9-to-5 job is so terrible for your health, especially as women. And we don't look at it that way. But when you look at how many times you need to use the bathroom, get enough sun, move around, get enough exercise, it's like, for a lot of people, what they're facing, and human beings have never been this tied down to these schedules like they are now. So you don't get enough movement, especially for us blacks. We're not getting enough sun, because by the time you get up in the morning, you're rushing around to get to the job, and then you get home in the evening, you're rushing to prepare meals, and then you're so on the wheel, the hamster wheel. So this is a question now, how do governments now, recognizing when you have a problem such as obesity and NCD rates running wild, how do we not just analyze the individual to say, well, you should do better, but look at how our society is set up to actually encourage these sort of behaviors that are not good for our health. Air quality. When you look at a lot of office spaces, I put up a post on my page to them, like, bring back windows, because you go into a lot of spaces and you realize people building spaces with no consideration to ventilation. It's like, I'll just put in an AC, and then they wonder why everywhere has mold and why people have so many respiratory issues. And during cold and flu season, it gets so rampant because people are in these enclosed spaces with recycled air. So these are the areas I feel that outside of the individual, we have to collectively look at how we organize our society and make certain decisions if we really want to have a effect on
You're
that.
correct. Government is best positioned to coordinate all of the actors, societal actors who exist to promote people's health. And you put information out there packaged in such a way, and packaged and delivered by professionals like our producer here, who know how to speak to people and package things. Because the assumption is that a doctor knows how to talk to people. That's an assumption.
That's true.
Right? In NCDs, you have to package things in a particular way because you are dealing with persons making money by packaging things. And but this is not the sole responsibility. So government is about coordinating. The government has resources, ministries that have a protective and information remit. Put information out there on the different platforms so people can access them, and ask for an all of society approach to protecting people from predatory marketers and profit over health people.
Yeah, and even at the profit over health, now I'm seeing World Health had issued this babies over profits, where they were saying the marketing of baby formula. I was like, World Health put that up? And they were very aggressive with it. And they were saying the marketing of baby formula as the first choice is irresponsible and is, predatory marketing.
Yeah, so I studied in that environment where I trained in that environment, and this is not a criticism, this is a fact. Where in the nursery, the hospital nursery, the companies were in there with their products. All right, so it's, sorry to repeat the point, it's a war.
It is.
It's a war. It's a war for heart and minds and wallets, and the obesity. The St.Kitts and Nevis's obesity rates are unsustainable.
And
children, teenagers, we're talking about 30% of children and teenagers being either overweight or obese, compared to 0% in 1989 when I started working.
Wow.
All right. The adults, we know from studies done in the 2006-2008 period that the majority of adults, especially women, are obese.
Yes.
Obese means not fat, but you're fat. To put it in colloquial terms. All right. I mean, if you're the typical woman, is 5'6", 5'8". If you're 200 pounds, you're overweight. If you're 220, 230, you're obese. Right? Obesity drives diabetes.
Cancer.
Right? Obesity drives certain cancers, arthritis. The links, obesity is inflammation, right? Which means that your body is being overworked dealing with this, right? And so we in the Ministry of Health, you will notice that we have adopted the posture and programming of emphasizing prevention.
Yes.
Because we cannot spend our way out of NCDs. So the United States is the country that spends most for healthcare, 20% of their GDP, almost 20% of their GDP, and it's still a losing battle.
Wow.
Right? So we are at about 6-7% of GDP. All right, for healthcare. All right, and so we know from evidence that you can't spend your way out of it, and it's an approach that requires a lot of
everyone
talking and giving people but also some taxes. We have to adopt what works, right? And so higher taxes on sugar laden stuff, unhealthy products, they have been shown to work.
Okay. And with that, we're going to have to wrap it up until next time when Dr. Martin comes in. And I think that we need to have Dr. Martin on at least once a month and have these discussions, because one of the main driving factors on a lot of the health issues that we're facing in St. Kitts is, again, obesity, NCDs. And so this is a conversation that we're going to keep.
The number one health concern is obesity.
Number one health concern is obesity. And so this is something that we'll be bringing constantly on the Health Link. But until the next episode, I'm gonna have to wrap it up and tell Dr. Martin, thank you so much again for coming through.
You're welcome. It's part of the work.
I appreciate ZAZ for having us as usual, and to everyone that listened. Thank you for tuning in. Until next week, this has been the Health Link.
Health is wealth, vital is vital. You can't rely on nobody else. Health is wealth, vital is vital. Try and take care of yourself. Health is wealth, vital is vital. You can't rely on nobody else. Vegan, we're vegan. Plant-based, we say. Long time Rastafari.